The title of my paper is The Impact of Trust in the American Healthcare System. Trust is kind of like pressure. You can't see it, you can't smell it, but you can definitely feel when there's a slight shift or change in it. Like, let's say you're floating around in space, your body's going to go through some uncomfortable morphological changes due to the fact that atmospheric pressure just doesn't exist. The same can kind of be said if you're floating around the healthcare system without trust. You're going to be subject to some undue anxiety and discomfort because you're soliciting advice from people that you don't even believe in. But let's take a step back. What does trust mean in the healthcare system? According to the people that I interviewed, trust is the mutual relationship between the provider, the fact that they're going to do their utmost to help the patient, and the patient, respecting the fact that the provider is licensed to give this kind of advice, even if you don't follow it to the letter. Let's go around and float in the healthcare system without trust for a second. What does that look like? In 1966, there was a study where about 75% of people had faith in their healthcare institutions. But in 2018, the same study was conducted and only 34% of people had that faith. What is that drop off due to? I would argue some internet trolls, but in all seriousness, COVID-19 is the example of that undue discomfort that we're now facing because we didn't have faith in our healthcare system. America is number one in research and number one in terms of medical personnel and resources. But now we're also number one in terms of infections. What gives? Now let's go back. Let's go insert health trust back into the healthcare system. What does that look like? On the small scale, people would generally start to get healthier, mainly because if they believed in the institution, they would be much more likely to follow through on treatments and procedures prescribed by healthcare officials. They would also be much more likely to forgive when mistakes are made, meaning that they wouldn't lose faith in the institution just because of a couple of stumbles, and the whole of society would progress towards that trust. On a larger scale, it kind of speaks to the level at which society is able to function, oddly enough. In Sacramento yesterday, there was a meeting discussing whether or not businesses should be penalized just because they don't enforce the mask mandate. That is not a good use of resources. It has been proven that masks work. So why are there government resources being allocated to this discussion still? Why are we still talking about it? I don't have an answer really for you, and I don't think it's an easy answer. My research, though, is focused on the role that trust is going to play in our healthcare system. If we have trust, what does that look like? If we don't have trust, what does that look like? And if we had trust, what levels can we reach? Because we don't have to worry about this little piece of society that seems to have fallen away. My challenge to you all are to go home and think about how can the healthcare system empower you, and how can you empower the healthcare system? Because if we do know one thing, we know we do not want to be floating around the healthcare system without trust. Thank you so much.